Alright, so today I'm going to be showing you how I would start a peripheral IV. So first I'm going to check the MAR, check the orders, make sure that one is even ordered. I'm going to check for allergies and gather my equipment. And then I'm going to check the med bag and the saline bag, check the expiration date, make sure there's no holes in them, stuff like that. Then I'm going to go to the patient's room. I'm going to provide for privacy, wash my hands, introduce myself, ask them their name and date of birth, explain what I'll be doing. So I'll explain that I would be starting an IV and hooking them up to an IV, starting them on saline and then their medication. And then I'm going to assess for pain, ask them if they need anything for pain or if they're in any pain. Then I'm going to compare the MAR with the patient's name and date of birth, make sure that everything is ordered. I'm going to check the med bag, make sure that the correct medication is there, that I have it, the correct dose, all that stuff. And then I'm going to label the bag and the tubing with my name or initials and date that I would be placing the IV and hanging the tubing, or hanging the bag and the tubing. Then I'm going to make sure all of the roller clamps are closed, and I'm going to spike the saline bag first and hang that up on the IV pole. And then I'm going to fill the drip chamber halfway to 3/4 of the way full. Then I'm going to prime my tubing, so I'm going to start very, very slowly, and with each port, all 3 ports, I'm going to turn them upside down and make sure that they have no air bubbles in them. And then once that's finished, I'm going to get out my secondary tubing, and I'm going to label that bag and that tubing. I'm going to spike the med bag, and then I'm going to hang that up, cleanse the first port on the saline or the primary tubing. I'm going to cleanse that with alcohol and attach the secondary tubing to the first port. After I do that, I would perform the backflow method to prime the medication bag by unclamping the medication bag, probably holding it lower than the saline so that it runs through, and the saline will backflow up into the medication tubing and prime that. Then I'm going to hang the saline bag lower than the medication bag, hang the medication bag up high, hang the saline on the blue hanger, and I'm going to count the drip rate, whatever the drip rate says that it is in the MAR. Next, I'm going to prepare to start my IV. So I'm going to place the patient in a low Fowler's position. I'm going to get my tape ready. Then I would label it with my name and the date it was placed. I'm going to then open the J-tube packaging away from me, and I'm going to scrub the hub of that J-tube for 30 seconds and then attach the saline and prime the J-tube. Then I would set that back into the package and get it ready for when I need it. Next, I'm going to find the IV, or where I want to start my IV, so I'm going to find my vein. I'm going to place a tourniquet on the patient's arm and see where a good IV is, and then I would take that tourniquet off, open my catheter packaging, and put on my gloves. So I have everything ready. Then I'm going to reapply the tourniquet, cleanse the site for 30 seconds with alcohol or chlorhexidine. I'm going to hold the skin taut with my non-dominant hand so that the vein pops out a little bit more. And then I'm going to tell the patient that they're going to feel a little poke. I'm going to insert the needle, bevel up, and then once I feel a little bit of give, I'll push it in just a little bit more until I see the backflow in the little window, the blood backflow. And then I'm going to push the catheter in and do the safety so that the needle comes through. And then I'm going to take the tourniquet off and attach to the J-tube really quick while holding on to my site, with the C, my non-dominant hand will be holding onto the site the whole time. And I'm going to attach the J-tube, flush the site, place the tape that I have prepared around it and the securement device so that it stays in place. Then I can take my hand off, and then I would undo the saline and throw my needle into the sharps. and then attach my tubing if I needed to. And that's it.